Hi, I'm Dr. Paul Jared Frank, Director of the 5th Avenue Dermatology, Surgery, and Laser Center. Welcome to one of my educational videos. Today I want to talk about cellulite. It's an age-old problem that's been very difficult to treat up until recently. There are many reasons why people have cellulite. Unfortunately, it's a problem that is almost exclusive to women, but it can happen in men as well. There are several causes. Most importantly, there are fibrous bands that attach from as deep as the muscle to the skin that pull down and cause puckering in the skin. There's also irregularities of fat in the superficial layer, which can be hard to reach and is non-responsive to diet and exercise. And finally, there seems to be a hormonal problem with the lymphatic drainage or the circulation to the area. Now, for years we've tried everything from creams, which were a total failure, to several non-invasive technologies. Things that use radiofrequency, heat, massage, and rollers, some of which have had temporary and minor effects, but usually require quite a bit of maintenance with little overall resolution or total result. And these treatments can get quite expensive. In the last year or two, we've had some newer, minimally invasive technologies that have shown to be quite effective by actually going underneath the skin, purely under local anesthesia, being able to break up those fibrous bands, melt the superficial fat, and improve overall circulation. In the media, these technologies, one of which is called Cellulite, and one of the newer ones I'm going to talk about today is called VASERsmooth. Now, both procedures are performed under local anesthesia. People can go to work the next day. What they do is they come in, they get a small sedative. Most people are quite awake during the procedure. Local anesthesia is infused, and we take small wands that go underneath the skin through small incisions that will close up without stitches. The procedure is short, is very safe, and has proven very, very effective compared to prior treatments, also showing long-term results. So we now have something that for the first time really makes a dramatic difference with cellulite anywhere on the body. And again, this procedure, VASERsmooth, I'm going to talk to you about, works by an ultrasonic wand that really delivers heat to help smooth out, almost ironing the skin from underneath. And we're going to do a live patient today, right here in my OR at the 5th Avenue Dermatology, Surgery, and Laser Center. We'll be right back. Okay, we're here for the VASERsmooth procedure. Today we're doing a cellulite treatment on the back of the thigh, under the buttock. Let's take a look at the area here. Obviously we're treating both sides, and what I did is I marked out the area, the general area, and then with marks where the individual dimples are. That is undesirable to the patient. Under local anesthesia, I made 2 teeny little holes that will close up without stitches and will be totally imperceivable in a few weeks. And what I do is I take a small little wand that's attached to a pump that basically infuses local anesthesia. And this is really the only part of the procedure that you feel. What I'm doing with a remote control is filling up the area with what's called Tumescent Anesthesia. You may get a little splash there. And it's very much like going to the dentist. You're really just feeling the sting of the local anesthesia. Once it's numb, you don't feel a thing. This treatment is just something you have to bear for about 5 minutes or so, even less. Obviously, it will take a different amount of time to do this procedure if you're doing more extensive areas, but obviously the posterior thigh and the sides of the thigh are very common. So then what I'll do is in the next stage of the videos, I'll take an ultrasonic wand, something about this size, and we'll go on to treat the area. So that's really the first step. Okay, so we're here in the VASERsmooth procedure. She's well anesthetized now. The local has kicked in about 15 minutes. We let it sit for. She also has a Valium-like medicine which is keeping her comfortable. Some people really don't need anything. Some people want a little bit more. But she'll be able to get into a car by herself, not drive, but be able to get home without a problem, be in zero pain, and probably be able to go to work tomorrow, especially since we're doing such a small area. This is the VASERsmooth wand. It's very, very thin, and it vibrates thousands of times a minute, creating an intense amount of heat. You wouldn't want to touch this with your bare hand when it is running. But it's very, very safe. We protect the skin by spraying some water over it. And what I'm doing is that I'll be going back and forth right underneath the skin, breaking up the fibrous puckers that are causing the indentations, and heating up the undersurface of the skin to tighten it. So we're really getting all the aspects that cause cellulite. Once it heals, the circulation will be much better, and the inconsistencies will be ironed out. I go through the little hole like this, and then I have my assistant put a little water on there to protect the skin, and then you'll hear the sound of the ultrasound, which should block out my voice. So let's get started here. I can actually feel the puckers being released as I do this. So we do this for about a minute. My end point is really feeling the smoothness of the skin. We're not taking any fat out like in liposuction, so then post-op we just put on a bandage, just like this. We give her a dose of antibiotic and we send her home. I'll see her a few days later just to check. She may have a little bruise, but unlikely. She'll take a few days off from the gym, and these holes will be closed up by the time I see her. And that is the VASERsmooth procedure, so we'll see you in post-op. Hi there. So we're in post-op for the VASERsmooth cellulite procedure. This was done a little over a week ago. She's done very well. She actually said she had no bruising, but she was a little puffy. We were probably going to see some difference now, but this is a procedure where it's going to work better. Usually at 1 month is when people start seeing their optimal results, and it's going to get better over time. But really what I like to show during post-op at about 1 to 2 weeks is that they're not too beaten up or swollen. They were able to return to work the next day and really have no pain or any complications. And if you get in a little closer here, this was the area that was treated. She may have a little bit of puffiness there, but nothing that's significant. The holes that I put are almost closed up. Certainly at 1 month you're not going to see anything. And if we had compared to the pre-op pictures here, we'd see that maybe thus far we're seeing about a 40% improvement, with hopes of about 70 or 80% improvement at about a month or so. So she's done very well. Most importantly, it was safe, it was a fast recovery, and it was a minimally invasive procedure that we really just have to do one time. So I'll follow up with her in a month, and that's our procedure. You can certainly take a look at our website at pfrankmd.com to find out more information about this and other procedures. Thank you.